my art has been commended as being strongly vaginal, which bothers some men. The word itself makes some men uncomfortable. Vagina.
This is preeminently the time to speak the truth, the whole truth, frankly and boldly. Nor need we shrink from honestly facing conditions in our country today. This great nation will endure as it has endured, will revive and will prosper. So first of all, let me assert my firm belief that the only thing we have to fear is fear itself. Nameless, unreasoning, unjustified terror, which paralyzes needed efforts to convert retreat into advance.
There is more that we don't know about the COVID-19 virus than there is of what we do know. For example, we do not know whether this virus is more contagious than an ordinary flu. Likewise, we do not know whether this virus is more lethal than an ordinary flu. As a result, we are at an information disadvantage. We don't have enough information to make intelligent decisions about how we should govern ourselves through this crisis, for lack of a better word. Nevertheless, we have closed most of our society on mere speculation, which the government has propagated relentlessly. There is no doubt that people should attend to their hygiene, avoid touching their faces in public, and keep a fair distance from sick people. This, however, is advice that people should follow every winter. The real question is whether the social and economic oppression, which we have largely accepted, will have been worth the cost. We may eventually realize that surrendering so much of our freedom to feel safe might not have been justified. In this information vacuum, we are stuck having to rely on the government and its made-for television drama. And not only through an apparent health crisis, but also a very real financial crisis. This carries with it significant risk. If history proves anything, it is that the government lies about everything. As a result, there is really no good reason to trust the government right now when it is imposing authoritarian measures. I'm not ready to turn full-blown skeptic. I am open to evidence that COVID-19 is a highly infectious virus with an alarmingly high fatality rate. By the same token, I'm open to evidence that we are substantially overreacting to the risk. On a related point, it is clear that this virus was created in a lab. This leaves me open to evidence that it is in fact an illegal biological weapon. I am also open to evidence that the virus was intentionally released in the public in order to create economic hardship on the people. This provides the opportunity for the multinational corporations and their partners in the United States government, the governing body of the European Union, and the Chinese Communist Party to exploit the financial distress which is literally destroying the known world, and in the process impose a permanent neo-feudal political system. At this point, I won't doubt the horror stories from Italy, Spain, New York, and other such places. However, the official record from my city suggests that this is not a crisis at all. Officially, we have had 529 infections with 8 deaths. This is, of course, unfortunate, but these numbers, by any rational metric, don't justify the economic hardship of closing nearly all business. Further, there is absolutely nothing going on at the big hospital in my neighborhood. The emergency room is closed to all patients. Even the doorway for the ambulances is blocked off. There may be a reasonable explanation for this, but if the health system is on high alert, my expectation would be that sick people would have access to the emergency room of every major hospital. In addition, there is a large homeless population here, and these people are generally in very poor health. My expectation, therefore, would be that the infection rate should be much higher, if we are getting the truth, the whole truth, and nothing but the truth. I mention this because the shelter-in-place orders come with some obvious risks, in addition to the extraordinary financial hardship they are causing. It is a scientific fact that stress weakens the immune system. Right now, people are bombarded with doom and gloom. They have become afraid of their own shadows, not to mention strangers and random joggers, even their own mail. It appears that many people are now suffering from chronic stress. Science has shown that chronic stress suppresses all functional parts of the human immune system. In other words, this chronic stress is making people more susceptible to the very disease they have become so afraid of. In addition, this kind of anxiety can cause a host of related problems, including feeling nervous, having a sense of doom, panic attacks, feeling weak, having difficulty thinking clearly, and having trouble sleeping. In turn, this can lead to clinical depression, problems at school or work, social isolation, substance abuse, and an overall lower quality of life. Further, the loneliness of social isolation will itself also contribute to a depression of the immune system. Social isolation can even lead to hallucinations. Similarly, the shelter-in-place orders include the risk that people will not get enough sunlight. Science has shown that insufficient sunlight depresses the immune system. Finally, the shelter-in-place orders are likely to cause people to sit more and move around less. This increases the risk of heart disease, diabetes, and cancer. All of these conditions, of course, also depress the immune system. It seems that the upshot of the shelter-in-place orders is that we are killing the patient in order to save him. But I digress. There is some good news. There are simple ways to overcome the negative effects of chronic stress. These are obvious. Get regular exercise, including outdoor activities and relaxation. Eat right, and get enough sleep. You can also give up coffee and liquor, but for most this is probably unnecessary. I looked for some clinical research on a possible corollary that if fear can make people more susceptible to disease, courage can boost the immune system. I could not find anything. I suspect that the answer is the same as it is with diet. That is, once you've achieved good health within the vicissitudes of nature, eating one more apple or some concoction of kale and quinoa won't make you any more healthy. On the other hand, you can eat yourself into bad health. Jack LaLanne always said that most people eat themselves into their graves. Most likely, once you have reduced your stress level as much as possible, you have done as much as you can to protect your immune system. On the macro level, the shelter-in-place orders pose the risk of creating a learned helplessness in the public. This in turn can be used by an untrustworthy government to persuade the people that surrendering more freedom will make them safer. This will make life worse, not better. I'm not prepared at this point to find fault with the government's response to the COVID-19 virus. Some of the evidence does compel extraordinary safety measures. However, we must in this process keep our eye on the ball. The government absolutely cannot be trusted. Further, rights surrendered are rarely restored. The most important thing that people can do right now is keep their heads and take care of their health. The Bill of Rights is a precious inheritance. We should be careful not to squander it on lies.